Hello, welcome to everyone on our YouTube channel Ayurveda Pravin. And today our topic of discussion is what is the causes of recurrent respiratory disease in child as per Ayurveda. Now, whenever parents enter with their child in our clinic, the one of the most common expectation of there is to get some medicine which can increase the immunity in a child. And yes, of course, we prescribe the medicine. But if you can see in a long term, it doesn't give them much benefit. They comes to you again and again. It is why because we are missing some fact. So today we are going to discuss how we can more enhance our treatment just by concentrating on a few points. So before starting that, respiratory diseases. The respiratory diseases are common cold, pharyngitis, laryngitis, tonsillitis, bronchial allergy, asthma. These are one of the most common cause of any respiratory diseases. Now, as you can see, this is the statistics of respiratory infection in India. Now, they are saying that 1/3 of the patient or a child which enters into our OPD are suffering from the respiratory tract illness. And 1/4 of a child which is admitted in a hospital are again suffering from the respiratory tract illness. This is data of a hospital, but in our OPD, we can say that 90-80% of a patient which comes are suffering from respiratory tract infection. And as we all know, the majority of the respiratory tract infection is caused by the viruses. So indirectly, low immunity, more virus infection. Good immunity, you will get race infection. Now, again, why the virus is keep on attacking a body again and again, more frequent than the other child. So again, as I told you, the two factor before starting the treatment which are most contributing factor for decreasing the immunity in a child is first age and second is your food habit. As we all know that child doesn't have good immunity. As they grow, they will get immunity or that body try to read and learn each and everything. Same goes with the food habit also. See, we are very poor in our understanding that at what age what is good for the child. I think there is some lack of knowledge in the Indian population nowadays that at what age what type of food is benefit for them. So again, we in a future slide are going to discuss on the same topic. So let's start with the topic that Pranavashota. So basically it's a respiratory tract infection and we all know. But why I put this slide is because as you can see on the screen, this is a area of kapha sthana. Means the kapha dosh which is responsible for growth and development of a body. Same kapha dosh is also responsible for decreasing the immunity in a body. So basically, if you want to increase the immunity, you have to treat the kapha dosha. So let's see where exactly the reference has come from. So this is a reference of Vagbhat Sutrasthan, 11th chapter, 8th slok. I have written this excessive of kapha dosh decrease child immunity. Means indirectly it is a immunity of respiratory system. I have edited some of the words in between. But in all line it is said that Shleshma, that is excess of a kapha dosha, cause Agni Sadhana. Agni Sadhan means it decrease the biofire of a child, which give rise to the Shwasa Kasa Ati Nidrata. Shwas means breathlessness, Kas means coughing. Means indirectly, the Vagbhat want to say that the excess of a kapha dhatu cause Agni Sadhan. This Agni can be related to immunity. And this Agni can also be related to the Amashay, where the formation of Rasa Dhatu take place, which is one of the most important contributing factor for the immunity of lungs. So if there is an excess of a kapha dhatu, vitilated kapha dhatu, it will decrease the immunity of a body and it will cause a respiratory tract illness like Shwas and Kas. So indirectly our role is to find out where exactly this Shleshma dhatu is coming in the body of a child. See, because if you can control this Shleshma in the body of a child, he will not suffer from a recurrent respiratory tract infection. But if he is not, we are not very good in handling this Shleshma Dhatu, then the patient is going to come back you again and again. So let's see what are the contributing factor for increasing the Shleshma in a body. So these four are one of the most common cause. As you can say in a practice, I think these four is only which you can deal with. And if you can deal with all these four separately, you can nearly cure or nearly can manage the patient very efficacy with very efficacy. And in today's topic, we are just going to concentrate only on kapha dushti. So because kapha dushti is, I think so, is one of the most neglected point in our GP. So why? Because as we all know that whenever child is born, we tell the mother that the child should be fed extensively on a milk for at least 6 months. And after the 6 month, yes, child is again depend upon the milk up to the age of 2 year. So whenever any patient less than 2 year or less than 6 month enter into your clinic, and parents is of course telling you that their child is suffering from common cold, or their child is suffering from asthma, bronchial allergy, recurrent, that patient have to admit it again and again in hospital. So all we have to consideration that since the child is mostly depend on the breast milk, the Ayurveda have different etiological factor, that is a kapha dushti. So indirectly we have to concentrate not on a child but on a mother who feeding the child. So, as you can see, what are the causes of a kapha dushti janya respiratory tract illnesses? What are the causes which can um, uh, which can vitiate the kapha dhatu and vitiate the milk? So, this again are four causes. The first one is gud krutah. The gud krutah mandaka dadhi abhishandhi ahar gramya anup udak masras. These four are one of the most common cause of stanya dushti, that is creating a excess of a kapha dhatu in a milk. And this excess of kapha dhatu in a milk when goes in the body of a child, they again cause a agni manda, that is decrease in a biofire and decrease in a immunity. So let's see properly what are the type of a etiological factor which is done by the mother who is feeding their milk to the child can cause respiratory illnesses in a child. The first one is a good kruta. Good kruta means jaggery product, but this excess of jaggery product can also be compared to the sugar product. As you can all see, the most of the child will suffer from the respiratory tract illness. The mother have a habit of taking excess of sugar. So whenever this type of patient, whenever enter into our clinic, we always try to tell them that you have to cut down your sugar. No artificial product of any sugar product. The second is mandak dahi. See, there is a basically very misunderstanding in a society regarding this curd. And I can see in a patient they are taking lots of curd, lots of yoga heart, and expecting that there will be some enhancement in immunity and which will again increase the immunity in a child. So because this is not a truth. I think so you should talk to your Ayurvedic doctor regarding whether you can there will be any benefit of taking any milk product to you. Second thing, Abhishandi Ahar. See, Abhishandi Ahar is nothing but your fast food. This fast food which you are taking, again type of a carbohydrate, again they have excessive of salt, excessive of sugar, means indirectly they all have a etiological factor which can increase the cough in a body. In same way, a gram mein anupras udak mas, means indirectly, if I have to say in a simple word, it is a non-veg food. So because this good krut, excess of sugar, this milk product, this non-veg, as per Ayurveda, it is considered as a very heavy product. So whenever you try to take a very heavy product and you also itself doesn't have a good immunity, this will always increase or violate the kapha dosha. So this vitiated kapha dosha, which is increased in a mother, maybe she is not suffering from that condition, but the same cough when goes into the milk and the child which is feeding that milk, maybe that milk can decrease the immunity, because as we all know, as said in a shloka, as we said in a Ayurveda, that if the child is feeding a milk which is vitiated by the kapha dhatu, it will definitely cause the respiratory tract illnesses. So, what is the treatment of this vitiated breast milk? Now, first of all, as I told you, this vitiated breast milk concept is just related to the child who's feeding a breast milk. But it can also be implemented on a child who was depend on the milk powder. See, because milk powder is nothing but again a excessive kapha dhatu. In some form, yes, you can take, but if your patient or your child is again suffering from the recurrent tract infection, or again he is getting a more respiratory tract illness, then I think you should consider uh, some of this concept and show to your nearby Ayurvedic doctor. Now, regarding the treatment of a sthan doshtijan, it is although I have put just one slide, but I think so one of the most slide is this one, that you should give a combination of Vasa, Musta and Ativisha. But this treatment should be taken under the proper guidance and qualified BMS doctor only, because this type of treatment, whether it suits you or will not suit you, will be decided by the doctor. And second thing, what more focus I give on is to instruct the mother to avoid all the kapha ahara. See, because if mother who's feeding the child will keep on taking this kapha ahara, treating the child will become more difficult. So all my focus is just on to make the diet plan of a mother, see to it what she's taking, and if there is a yes excess of cup, if she's taking any of the hetu which we are discussed about, like excess of milk product, excess of sugar product, excess of fast food and non-veg, it should be stopped. I think so. Non-veg, stopping non-veg, many of you will not agree with me, but it play a very important role in your etiological factor of respiratory tract illness. So if I have to avoid recurrent tract infection in a child of breastfeeding mother or a child of below 2 year who's all depend on the breast milk, I will just focus on all this stuff. Now, in a treatment point of view, the same medicine which we give to mother, we also give to the child. But as I told you, okay, if the patient or a child is more focused on taking extensively feeding on a breast milk, then you have to treat the mother. You don't have to give medicine to the child. All you have to do is treat the mother. So this is a very different concept which is in Ayurveda, that you should treat the mother. So if you can treat the mother, you can give all this medicine to mother. The breastfeeding milk may increase the immunity in a child. So this is again, as I told you, there are other factors also which we are going to discuss in a next chapter. But this you have to consider, that in a treatment of a sthan doshti respiratory tract illness, you have to treat the mother, not to the child. So you can see benefit clinically, you can see a benefit, much benefit than anyone else. So thank you very much, and you can give your comment, any suggestion regarding this chapter, regarding this topic, regarding the presentation, you can give in a following comment, and you can again personally text us on our FB page Ayurved Pravin. And thank you very much.